Welcome back to All Health. These are podcasts where we always talk about health issues that really we do face in our daily lives. And today we are going to talk about a condition that is actually very common. I've seen very many patients coming with it to clinics and hospitals. And actually very many people keep having this condition not until when they start seeing side effects or when actually it has gotten so severe that it is causing serious complications. The host today is going to be Dr. Sulaiman Namoza, the voice you're hearing, and I'm with my colleague Dr. Ainembabazi, Derrick, who is going to give us a very, very nice and detailed information about this condition, that is hypertension or high blood pressure. Dr. Aine, you're most welcome.
Thank you, Mugama.
Jolly.
Hi, my name is Derrick Aine, medical doctor or medical intern, almost finishing. We shall be talking about hypertension with my colleague, Sulaiman.
Okay. Yeah, thank you very much, doctor. I think without wasting any single second, for someone who is watching this podcast, they would like to first of all know what high blood pressure is. Which blood pressure, if someone measures their blood pressure, which blood pressure, should they consider to be high blood pressure?
Okay, so that definition is very broad.
Yeah,
so
true.
hypertension or high blood pressure, to define it in one sentence is quite difficult because we have cutoffs.
Exactly.
So when you go to the clinic, a doctor will measure you with that machine they tie on your upper arm and to give values. So anything 120 out of 80 is considered normal to the general public.
Yeah, true.
But then as well, anything 120 to 129 over 80 to 89 is still considered normal. Because the cutoff still is according to age, race, so things like that. So anything beyond that, when you start going above the 129,
yeah, true,
we start thinking that this patient might have hypertension. But then again, we cannot use one reading to say that someone has hypertension. So you cannot have one clinic visit. You come to the clinic and they're like, hi, we have diagnosed you with high blood pressure.
After
so
a
it's
girlfriend giving a phone call to her and they say
you might
broken up.
Exactly. You might have problems. Some people actually just fear the clinical court.
Yeah, true.
You enter the hospital because the doctor is tall, scary.
Yeah, true.
When they measure your blood pressure, it is high. So we can't use that reading to say that someone has high blood pressure.
Exactly.
But if on consistent visits, what they actually normally do is you come today, it is high, they send you back, they tell you about lifestyle, diet, everything, then they tell you come back after 2 weeks. So if you come back after 2 weeks and it is still high, and with history of things like in my family, my mother had hypertension, this and this, the age, your weight, they can now start classifying you as hypertension. So the values, we can use 120, 129 as normal out of 80 to 89. Then above that it becomes worrying. And then you can further classify it into stage 1, stage 2. Most of those things are clinical for the doctors, but anything above those values over a period of time, you can consider as hypertension.
From the information you've given, this actually implies that someone can't, a patient can't come to the clinic for the first time and they move out diagnosed with hypertension, right?
No, you cannot. It is over a period of time.
I get you.
Give it 2 weeks. Come today, it is still high. Come back next week, it is still high. The other week, it is still high. We are going to start investigating your heart. And
okay. Thank you so much, doctor. Yeah, after someone knowing what hypertension is, I think people need to know also what are those, risk factors that can make someone, can lead someone into that hypertensive condition or
risk
hypertension.
Factors or things that can make you to be diagnosed with hypertension. No, if you have this, you should actually be worried.
Yeah, true.
The very first risk factor we used to have those days was age. That's anyone older than this, 45 or something, you're at a higher risk because, of course, your heart is getting tired, such things. Then there are things like weight. In medicine we use the BMI, We don't just use weight. Yeah, but the people who are, I don't want to use the word obese or big,
Obese, yeah,
because some
true.
people say it's body shaming. But if you're overweight, again, there's a scale they use. They weigh your height, your weight, they calculate. If your BMI is in a certain range, might
They
be considered
classify.
hypertensive.
I
Yeah. So
get
that is
you.
a very big risk.
Mm.
But in the community we live in nowadays, the risk factors we have, it's mainly lifestyle, lifestyle things.
Yeah,
So
true.
things like we live a sedentary lifestyle, most of us. You just come to office, you sit the whole day, then you go back home, you eat. You're comfortable.
Actually, you come driving.
You come driving, you work, seated,
You
so
take
the whole
breakfast,
day.
eat lunch.
So that kind of sedentary lifestyle, there is very little physical workout and all that stuff. Then also there's a lot alcoholism, of course, things like alcohol, smoking, very big risk factors, and that is why age is no longer like one risk factor we use to think about hypertension, because now younger people are living a very bad lifestyle. We're taking too much alcohol, we're smoking a lot of cigarettes, shisha. So things are changing now. The trend is you will find 30-year-olds, 25-year-olds being diagnosed with hypertension.
Yeah, true.
With nothing like family history, because back then you'd say family history, genetics, what. But it's because of the lifestyle we're living, the food you're eating,
Yeah, true.
the fats in the food, the alcohol, the everything. So that's why it's very easy to find a young person nowadays
Being
with
there.
hypertension.
I get you.
Lifestyle mainly. And I think it's mostly of a lifestyle disease nowadays. Yeah, more than anything else.
Okay.
Yeah.
We have, most of the people in our age are renting,
Stress is a very big factor. Stress alone. There are people who get stroke because of stress. So it's a very big factor, and it's very difficult to thrive in this community nowadays. Making money is not so easy.
Yeah, true.
So that's why the environment. This is it's a non-communicable disease. Just the environment around you will decide whether you have this or not. So look around that. The lifestyle you live. Are you an alcoholic, a smoker? Are you living a sedentary lifestyle? What food are you eating? Does it have too much salt in it? These people who order for Relax and like kunyanya take a simple things like that. So with time it accumulates, and
it
will catch up with you. Yeah.
Okay. So, doctor, this condition, hypertension, actually, it is usually called a silent killer, Why is it so?
Yeah, because for most of the people that are diagnosed with hypertension, for the very few that I have seen, who are still many, that have seen it at the first time, it's usually they come with a stroke.
Okay.
And that's the first time they are knowing that I'm hypertensive. Actually, the pressures were very high. So it's a silent killer because it will not give you any symptoms. If it's to give you symptoms, you might get some little bit of headache sometimes.
Okay.
Tiredness, is a fatigability, but you might not notice. But your body will be telling you, because you're having constant headaches. They're not going away. And people go into self-medication, they take Panadol, what, but it's not going away. Headache, you're tired, you climb stairs like this, and you're panting. Your body is communicating, but you do not know.
You do not know.
So it will not give you clear symptoms until it's like out of the range, until it has reached to like the complications. You get it?
I get
That's why it's a silent killer. Yeah.
So most of the people actually live with the hypertension and they don't know it.
Yeah, and we don't know. I also, when I discovered that, I started measuring my blood pressure. Like every week, I try and see, because
exactly.
So it's silent, and you will never know.
So people should actually make
Yeah, regular visits. We have a very bad health-seeking behavior. We don't like going to the hospital unless we are sick.
Especially men.
It's very difficult to convince a man to go to the hospital.
Exactly.
When it's just headache. That's why you can just go and do random sampling. You pick like a group of 10 people. You come with your BP cuff and start measuring. You will be shocked at the results you get. Yeah. People will come when it has reached the severe end. The most common in Uganda is when they have gotten a stroke.
Exactly.
Yeah.
I get you. Okay, thank you so much, doctor. So, someone has been discovered with hypertension. In the hospital, we can't leave that patient go without medication being prescribed to them. Or actually, if it is there, we give it to them. If at all someone, is hypertensive and they are not taking their medication very well, what are they risking?
Okay, now the heart is one of those, should I call it a vital organ, like it pumps blood to your whole body. So if your heart has a problem, most of your body parts will have a problem. So when you diagnose someone with hypertension, that's after like 2-3 clinic visits, you start them on medication. What I have seen is that most people after like 6 months, they believe they have become better and they stop medicine.
And they stop taking their
So how do they come back? They always have a stroke. Always have a stroke. And that's what happens to most people in Uganda anyway. They come back with a stroke. And when you start probing, they tell you, I used to be in pressure. That is all they say.
I get you.
So in Uganda here, most of them come back with a stroke. Of course, there are other ways it can present, but stroke is the commonest, and I think it's the most worrying. Yeah. So they'll come with a stroke, and then you'll start probing. This was a hypertensive. Stop medication.
I get you.
I get it.
So let us just pause around that stroke. If at all someone has gotten the stroke, I've ever had a patient, actually a relative. They gave me a phone call. They were like, "Hey, jaja tetumutegeera. One of the arms is not what?
It's not moving.
Is not moving. Stroke. If at all someone, what are those, presentations that someone should
presentation of stroke,
be that someone should see and they be like, this is a stroke, because I know one of the things of the severity of the stroke also depends on the speed of
how the body responds.
Actually, like the how the people around that patient are quick to make sure that this person gets that first aid.
That treatment,
Yeah.
Actually, usually if someone gets a stroke and you realize it in the first 4 hours, usually they can be saved. But again, in Uganda, because people take long to realize, and of course we have a not so good healthcare system, and our health seeking behaviors are not good, and most people don't know these things. They come in later. So the stroke patients, the presentation is usually classic. They will come when one side doesn't work. So if it has hit on the right side, the left is usually down. And other presentations, some they're not talking, or they're talking things you can't understand, can't lift this eye. But the classical symptoms is that there will be what they call hemiparalysis. One side of the body is not working. It could be both if a stroke has hit both sides.
True.
But one side is not working. That is how you can tell that someone has a stroke. And most of the strokes in Uganda that we see, the biggest cause is hypertension. So it all stems from this. The pressure becomes too much in your blood, and somewhere in the brain,
and that is the worst.
You have bleeding in your brain. That's a hemorrhagic stroke. So if it bleeds this side, you will have paralysis on this other side. That's a classical symptom. Now, some people are lucky, these ones that are newly diagnosed with a stroke and everything, within 1 or 2 days, put on medication, lower the blood pressures, and then the stroke disappears. Like the man is walking properly after 2 days. Some people are not so lucky. The bleed is too big, but it actually requires surgery.
Exactly.
That's the one, the bleeding, the hemorrhagic. Then there's also that stroke where it's like a clot. And still the risk factor is usually hypertension.
Exactly.
It's like a clot in your brain, something. Now that's a difficult one to manage because you can't. And those are the ones that are usually bedridden for months, years, and everything. But again, when you probe and you try to understand what caused it, like 90% of the people, it will be the hypertension. That's why it's a silent killer. So it will start as a high blood pressure you didn't see or you saw. You took medicine and stopped. Then after stopping, you get this stroke. The stroke comes with its complications. You aspirate and then
you go.
Yeah.
I get you.
I get it.
So, Doctor, we've mainly talked about stroke, and I think stroke is one of the high-end complications
of
hypertension. But there are these, common ones that people should watch out. So, Doctor, on the complications of hypertension, we've mainly, talked about stroke. What are those other complications, that may come due to the
Okay.
hypertension?
So I've mainly mentioned stroke because it's like the largest and the scariest for me that I've seen. But then again, like I said, the heart is one of those vital organs. So if you have anything damaging the heart like hypertension, you expect to have damage to the kidneys.
Exactly.
So you'll end up things with kidney failure, which I think should come second. But that will come in later, like after years of resistance. The stroke might not even let you reach the kidney damage and everything. Yeah, and with time, other organs can get damaged. Hypertension can also cause that blurring of vision, or that haziness. Some people actually don't see, and it's usually high blood pressures.
Yeah, true.
If you remember in ophthalmology, hypertension, the blood pressures are a very good risk factor to one of glaucomas. I've forgotten which one exactly. But yeah, it can cause end organ damage to any organ in your body. Just because of the high blood pressures. Yeah,
I get you.
so that's how bad it can be. Silent.
Okay, so as we are coming to the conclusion of this podcast, of course we can't prescribe for people medication on this podcast, but we can actually do a hint on how we manage the hypertension.
So it's a lifestyle disease, and most of the management is you modify the lifestyle. But you should know that we said in the beginning, it can be classified as pre-hypertension, hypertension. There are classes of hypertension. So depending on the class you are at, you'll either get medicine or not. So if you're still, let me say, if it's not yet severe, those pre-hypertensive people, they can just tell you to modify your diet, reduce your salt intake, quit alcohol, start walking like 30 minutes every day, or go to the gym, something like that.
Do some exercise.
Just lifestyle modification is enough for and it can help the younger people. So go jogging, play soccer, those things. But then when it crosses that point, lifestyle modification alone cannot be enough.
Yeah.
That's when they start introducing in drugs, and this one the doctors know. They'll start giving you things like what is prescribed a lot. I see most patients on losartan. Of course, in medicine you start with the calcium channel blockers, because of black race and everything. And then it's usually they start with one drug. If it's resistant, they add something else, then they add another, then add another. That's how they manage it. Yeah.
Okay, thank you so much, doctor. So as we are, coming to the end of this podcast, what are some of the, advice you could give to our youths that side who are there watching this podcast, and those people who, our fathers and
Our fathers.
and mothers?
Okay, so to the people watching us, if you're to forget everything, just remember that everyone has a heart. The heart pumps blood, and it gives us some pressures that are usually within the normal range. But because of the lifestyle and environment we're in, sometimes, and genetics and family, sometimes your heart might not function well, and it will give you a high blood pressure. And the only way you might know that is if you go to your doctor regularly. Regularly can be like every 3-6 months, and just check your blood pressures. It is actually free in some pharmacies, some clinics. Check your blood pressures regularly and get advice from a health practitioner, because you don't want to be at the end stage of things where you're taking a tablet every day for the rest of your life. Thank you for listening.
Maybe as you're closing, can someone buy a blood pressure machine?
Yeah, you can buy a blood pressure machine. There are those portable machines. You can always have them with you. Although they might not give you very accurate readings, but they can give you a hint.
There are those manual ones, but then, nowadays we have even these digital ones.
Digital things are there. Don't do those things of pumping. You can just put it here.
Okay.
Okay.
Thank you very much, Dr. Ainembabazi. Derrick, it has been nice to have you here on All Health. The person on the camera is Enzaim, our producer. And to all people out there, let us value our health. Health is the initial capital you have as a person. If you're healthy, that means you can do any work. If you're not healthy, there is no work that you can do. It has been All Health, talking about hypertension. Dr. Sulaiman Namoz has been your host with Dr. Derrick. See you in the next episode.